When you sit on a board of a PacMed, you hear big scale problems, but you don't see the day-to-day issues in clinical environments or problems. So when my team and I joined as entrepreneurs and residents, we call ourselves the free-range EIRs because we were given no guardrails. And we thought about, well, geez, you have to do something in prevention. You think diabetes and these long-term care costs and these huge chronic care conditions, and you think to prevention. And then you realize nobody is willing to pay for it in this country. And that's an ungodly realization to come to. And I think that you're going to see more and more drive towards that, but it's still a fee-for-service world, and how quickly that shifts to fee-for-value, and that is a big open question on timing against things. But it is complicated. Hospitals run on 1% margins, and they have a hard time investing in future-oriented projects and innovation. Insurers aren't necessarily much better, and so you've got who's making money in the industry, who's paying for the innovation, and oftentimes you say pharma, who's the bogeyman bad guy for a lot of things, or device equipment manufacturers that are raising ungodly prices for MRI machines, et cetera. But it's intellectually fascinating, threading that, but you've got to find the opportunity that creates itself amongst that morass.
I would say from the investor perspective, it's a great time to be in healthcare because there's actually a lot of capital that's looking at healthcare, which I don't think we've had historically. So there's a lot more money. You see it with, strategic investment for where I'm coming from, where you've come from as well, and a lot of other firms, whether it be payers or providers, you spent time at as well, and that kind of area. So a lot of well-funded companies are putting their money towards innovations within healthcare, and I think having access to that capital will really be a catalyst for kind of moving healthcare and digital health and those innovations forward faster.
From my perspective, the degree of excitement and enthusiasm and complexity is directly attributable to what perspective you're coming from, right? And I think the challenges are different because as an operator, if you're the customer side, whether you're in the integrated delivery system or you're a health plan, one of the challenges I always had was around, managing through this long litany of all the regulations that we just had to implement. So, on the surface, it's like when we talk about all this healthcare stuff, and we've all seen a gajillion ideas and startups, but why aren't all of them successful, or why are so few successful? That thing it goes to, a lot of the things that happen at the operational level. If you're the customer, it's like, you're just trying to, keep the lights on. When I was running a health plan, I had, IT operations reporting to me, and when you go through the list, it's like 95% of my bandwidth is focused in on just like, compliance related stuff. So I got 5% bandwidth to deal with this backlog of stuff that I was trying to do for the last 5 years. How does that next innovation get to that top of that list, right? That's one of the questions to ask. And how does that change my life as a customer in the next 12 months? Because I've been burned, right, by all the other startups out there that have said, I'm going to promise you X, Y, and Z. None are differentiated, you can't measure it, and all this other stuff, right? That's one perspective. From an investor perspective, it's like, you could see different companies maybe getting early traction, but from earlier stage, and Bain was, maybe, more mid-stage and so forth, or late stage, but being able to project out, I think, is really critical. So whether, whether you're an entrepreneur or as an investor, surrounding yourself, right, with people that really know the space and that can help you navigate that, I think is really important, because I'll tell you, being in this industry for over 20 years, it's still confusing for me. It could almost be debilitating to kind of say, well, which one do I really focus in on? What sector, or how do I shape my business? And the guidance that I give to my team and the things that I look for in investments are things that are kind of immutable to things that are changing in the regulatory environment. So
it feels like the established approach to medical technology is you find a need, and then you identify a technology. Although actually a lot of us do it the other way around, right? A technology in search of a need. But then we try to figure out how to get through the regulatory maze. And we try to figure out what the financial revenue plan is for the customer. That's why we're always talking about CPT codes and stuff like that. and then we go try to find the early adopters, right? That's sort of the standard mechanism in a medical technology. But it feels like we're in a new season where things are different. The healthcare providers are overwhelmingly bulking up, right? M&A going on everywhere, right? And then we don't talk about it very clearly, but what's going on is the risk is getting shifted. You know, it used to be insurance companies, and then it went to self-insurance for employers, overwhelmingly, not completely, but overwhelmingly. And now we're asking providers to be risk-bearing entities. The political pressures are mounting. There's just anxiety riddled all through the whole system. And one of the examples of that is the percentage of active physicians who are in private practice going down like this. They're going to become employees more and more. There's a whole bunch of this stuff. And above all, out there is this just mounting pressure on cost, right? For good reason, right? We spend too much on healthcare in this country, so much that we have really imperiled society's ability to do other things. But it's not at all clear how we're going to take cost out. So a startup typically focuses narrowly. You know, we got a product and or a service, and we're going after a market. And now we're asking startups to, oh, well, you need to look at this amorphous, changing, dangerous landscape out there and adapt to it. So how does it seem from your perspective? Either you're investing in early stage companies, and you guys are relatively early stage companies. How does this larger context feel and seem to you? How have you considered it, or have you considered it as you have developed your products and your marketing strategy?
So I can speak from our portfolio company's point of view. We probably have about 25 companies in our portfolio right now. And I would address that from a customer perspective. So how do you think about your customers? You have small doc practices being bought by the larger health systems. You have a change in risk that's shifting away from the payers and more to providers. But then you also have a lot of dollars that are sitting at all these kind of in the establishment, the healthcare establishment. That's where the dollars are still right now. They're in the payers, they're in the providers, they're in the large brokerages. So I think you have to kind of have a spray bullet, I guess, or spray bullets around to actually get to the customers that you really want to get to. So all of our startups, if you look at how they're addressing their go-to-market strategy, they're not saying, I'm only going to focus on payers, I'm only going to focus on providers, I'm only going to focus on employers. They're focusing on all of them. And that's really hard from a capital standpoint. I mean, if you're an early stage company, you don't have a lot of resources. You probably only have 1 or 2 salespeople, one who's probably your CEO. So how do you focus on that? That's a harder question, I think, to get to, but you have to play many shots on goal, because if you look at a payer, they take 18 to 24 months to hire or to make a procurement decision. Providers take maybe a little bit less. Employers might move a little bit faster, but how do you make sure that you're well balanced to be able to get to scale as fast as possible and get those revenues in the door? And that's actually having many shots on goal.
The providers are getting paid less and they're seeing more and more CMS patients getting paid less and less for that. And from my perspective, the only way you're going to engage with that fact is digital engagement, and that's going to be from getting the patient more active in their own health and also tracking when necessary intervention. Because, you know, typical person sees a doc 2-3 times a year, and what are they doing in between that affects their health? And it's that shift of capitation, that insurance risk that the providers are starting to assume. The providers are going to have to be more aware of what that patient is doing outside of the walls of care and outside the visit, and tracking and engaging against that patient.
As a customer, because of where my, how little money that I have, right? Because, health plan, you're very narrow margins, and provider, very narrow margins. I frankly don't buy anything that's a nice to have. In fact, a lot of the stuff I need, that's still backlog, right? So if you come up with an idea that's a nice to have, my best advice is don't do it, right? Because that's just probably not going to happen if you are selling to those particular systems. And then when it comes to, when I think about what forces me to buy as a customer, I'll tell you the number one thing is going to be compliance. The different segments. You need shots on goals, that's right. But how do you then satisfy the unique needs of all these different segments with your business, So what we've done from a Rejuvenly perspective is that we've created a platform that addresses the issue at a consumer level, so that irrespective, and I'm not saying you guys should do this, I'm just saying this is what we've done. It doesn't matter where you're working. If you're working for if you're a Navy SEAL, you know, if you're working for NASA, if you're a Medicare enrollee in a Medicare Advantage plan, or you're a patient in a providers group, doesn't matter. You still have the same problem, but the value proposition to each of those segments different. And so that goes to our earlier point about knowing the intricacies of the healthcare system and how to position your product to each of those segments. Because when I cut costs in one place, you guys all know, that's taking money out of someone else's pocket, and vice versa. And you really need to surround yourself with people that really know the sauce to be able to nail that value prop.
Who's your customer? And now, is your customer the integrated system that's actually moving towards risk bearing and it has an incentive to do this kind of stuff? Do your companies have, you talked about multiple shots on goal, but though, is there a different customer for each shot? Is it really one goal or multiple goals? And you talked about the consumer, but is the consumer really your customer? Who's paying the bill?
I think that your customer also needs to be the person using it, because the interesting thing in healthcare is the person that actually has that risk is relying on you as a patient to take the right risks for yourself. They don't want you out there, you know, riding motorcycles and bungee jumping, right? But you're making a personal choice. So they want you to make the personal choice to use a tool, to use a service that's going to help bring down costs for them. So I think the hard part in healthcare is it's really a dual sale. It's a sale to get the person who's going to show or affect the behavior to use the technology, and the sale from the dollars coming from the person who's actually at the end responsible for the risk associated with that patient.
First of all, it goes to what type of business model that you guys work with or are in, right? Because if you're B2C, well, that's one answer. If you're a B2B2C, like we're talking about, you know, that's another answer, right? We need to satisfy, if you will, right, is the consumer level. Because if that doesn't happen, there's not going to be, the sponsor's just going to crap all over us, right? I mean, they're sponsoring it for a reason. But I think that depending on which sponsor it is, the value proposition is different. I would agree that ultimately who pays the claim is absolutely king.
Not only the care of patients, but the decisions about new innovations are all going to be evidence driven, right? This is the age of evidence, right? I can imagine getting there with evidence about patient outcomes. How on earth do I get evidence about cost? And so what's your sense of what's going on out there in terms of the need for evidence, and how on earth innovators are going to develop the evidence such that whoever their customer is, they might actually be able to get a purchase decision?
From my perspective, maybe there's two ways to look at this. Like one, which is traction or real scale, right? Because the hump I have to jump through to be able to do those two things is really different. Looking at the stage of the company, right? Because ultimately, at the end of the day, of course, we all want all the, you know, the pretty graphs and showing all the metrics and all that kind of stuff. But at the end of the day, right, and we all know this, when I'm looking at healthcare cost reductions, why is it that when you're in a health plan and I've got 20 different vendors hitting the patient, and there's first of all, when the claims go up, everyone says that none of them were responsible for that. But when the cost goes down, everyone claims credit, and guess who gets paid? Nobody, right? Because it's not unique to your data set. So what I would really encourage, and my perspective on looking at data, is choose where you are going to make your stand in your startup to say that those specific data sets are uniquely yours. Because if you choose those other things where there's other people touching it, you're probably not going to get full credit for that, right? And you're probably going to get dragged down by everybody else if they screw up too, right? So, so when I look at from a getting started perspective, choosing those specific data sets that are going to be valuable for your business is number one. And then number two, I think finding deployments where you can get those measurements, and then maybe taking some other corollary existing data sets out there. If someone's already paved the way that gets you 70% there, you might not get full credit for that, but at least take those data sets, line it up, and at least maybe you have a case. Because otherwise, I think from an investor perspective, and certainly from a customer perspective, it's a lot for me to ask to write a check or multiple checks for this really long situation where outcomes may or may not materialize. And if I'm a customer, I mean, right, as I mentioned, I have very little bandwidth. So I'm already weeding people out left and right for every single reason. And then if someone comes into my door saying, I'm proposing an R&D project with you, you know what I'm gonna say? I'm sorry, I don't have a whole lot of time for that, you know? So I apologize if I'm a little more bare knuckles about this, but at least that's my perspective.
Well, I think also that what you talked about leads yourself into value-based pricing, right? So if you pick those particular outcomes very specifically, you can say, because I drove those, you can then start to pay me based on those. And I think that's some of what we're starting to see in the market. I'm going to look for these KPIs, and if I meet these KPIs, then I can shift my pricing that way.
Given the fact that there's so much merger and acquisition activity in the provider community, some people would say that really it's all going to be B2B, and they don't mean business to business, they mean big to big, and therefore every small company really should aspire to be acquired by a big company because you're not going to be able to market on your own. But the flip side of that is, if there's lots of bulking up going on, then there aren't going to be 40,000 different healthcare providers. There's going to be 3,000, and therefore your marketing becomes a lot more focused, and your sales effort, and you really could aspire even as a small company to sell into that environment. So which one do you think is right? Or is it really technology dependent? Or I mean, it seems like the waves of change in healthcare are so significant that we, the innovators, have to adapt to what's going on there rather than expecting them to come to us. What's your sense of the go-to-market realities?
It is a challenge. I mean, it's a challenge for early stage companies to kind of hit those smaller customers, and that's the unfortunate part about it. Those are probably the small doc practices, the small employers, the smaller, family brokerages. Those are the people that can actually drive innovation faster, and it's got to be it is very frustrating for startup companies to try and target them because it takes a lot of effort and they just don't lend yourself to a lot of revenue. So I think the situation is now that companies are focusing on the big elephants, right? The big provider systems, the big payers, but I'm hoping that there's technology and platforms to reach to some of these more distributed customers that are actually going to make it a lot easier, but I don't have a good answer, to be honest.
Obviously, with consolidation means a consolidation of purchasing decisions, and if you miss a key account, your odds have diminished. But there's so much fragmentation out there right now. I mean, Providence is a top 5 provider system, and I think they've got 2% market share in the country. It's that fragmented, and so some consolidation will be good. I think that you're going to end up, everyone says consumerization of healthcare, and you can kind of mix and match what that means, but people are paying for an experience, and that's their interaction with the doctor, and everyone's got a great experience with their doctor while they're in that office. Then it falls apart. It's like booking the appointment, scheduling, getting there, parking, on and on and on, getting the lab results. It's just a horrendous user experience from what we perceive in every other industry. And I think when you've got consolidation, people are going to choose their provider, their system, where they choose to spend that consumer dollar based upon their experience with the providers. And so those providers are going to have to enact better experiences, and a lot of that's going to be technology driven, and how do they improve the overall user experience for that consumer interface with the providers and the payers.
Early on, when I look at investing in the companies, I'm less concerned early on about the revenues, even though that's important. I'm more concerned about kind of that proof of concept aspect to it, because then I know this thing can scale, right, if I throw some more money on this thing.
What are the realities? I mean, what should entrepreneurs know about the realities of getting funded today?
So it's funny because today looks very different than a year ago, which looks very different from the year before that. We found that when I joined 3 years ago, everybody was really into digital health. This is a time when you have companies like Castlight were going public, and if everybody knows that story, the stock price went like this, and now it's somewhere down here. So you're starting off like, and that's right here was a couple years ago. So there's a lot of new people interested in digital health. There's a lot of tech investors that were interested in putting money to work. A lot of money sitting on the sidelines for many years, and that was a great time to raise money, to be perfectly honest. And that's since slowed down. You have digital health. If you look at the public companies that are not trading like they used to trade, and you have people pulling away from higher risk digital health or healthcare investments. So pulling away from the seed and early stage investing to going more towards the Series C or the later stage investing, because they see a pathway to profitability, see a pathway to not burning a lot of capital. That being said, I think there's still a lot of investors out there that are interested in digital health because it impacts so many people and it has an opportunity to make such a big difference. I think people are just going to be a lot more diligent, so it's going to take a little bit longer, but I think there are the right partners out there, and there is a benefit of a lot more strategic capital out there, and the right strategic capital can be super helpful when you think about things as, leveraging expertise in-house and having people that have experience in your particular area. So I do think the money is there. I think it's just not quite as out there as it used to be a few years ago.
I think there's some huge unmet needs that frankly nobody's investing in here. Diet, like we all talk about health and wellness. I mean, if someone solved healthier diets for the country, that would save way more money than anything we're talking about here. And you can talk about end-of-life care and advanced care directives, and if you had incentives for people to do that, that would save a tremendous amount of cost in the system as well. So I think there are some almost public service goods that need more than just investment capital. You need government messaging, you need large charitable foundations all wanting to support this at broader, healthy lifestyles and more meaningful lives. And I think we shouldn't just get so concentrated on solving these little minute problems that solve X, Y, or Z, but these broader macro issues that are affecting the healthcare costs in the U.S.
We all don't know what we don't know. And I really think that it's helpful to surround yourself with people that have similar vision for what you want to do, and can be very honest with you too, and give you some tough love if you need it. Better to know that early on and kind of shape the course of the company than to kind of go way down the path and then regret it, later. So I would really encourage you guys, seek those people out and really try to sift them out from, the real one versus, the person who sounds interesting but, can't add any practical value. Just
be patient with the opportunity that's out there. I mean, we're in a highly regulated industry. We have completely antiquated technology systems, so there's a lot of opportunity and a lot of dollars out there to be saved, and a lot of dollars out there to be made, but it takes time because the current players in the system take a long time to move.
Yeah, know which segment you're going after and network the hell out of that. Get people mentoring, advising, getting involved in the project that you're hopefully trying to come to a solution with, and get them invested in your either time or money or energy, and have them evangelize on your behalf, and that will help pave your road far more easily.
Do you guys see any kind of a tension between, obviously where we are with per capita spending in this country versus others? You would think the real opportunity would be in savings, reducing and bending that cost curve. But have you guys actually seen success in selling into savings? By comparison, the sales process is so much easier to say, I'm going to put extra dollars in your pocket, doctor, or I'm going to sell you a procedure that's going to be 5% better. You can bill for it. You can bill twice as much. I'm actually going to bend the cost curve the other way up. Have you seen any success in selling into savings?
Yes, but I think programs that actually reduce chronic conditions or sleep disorders or anything like that would actually reduce the cost in the system overall. In theory, you'd put something in place because the return to the person who's paying for it would be outweighed by the amount that you were paying. So I do think there definitely is a market for reducing costs in the system. But there also is a market, to your point, in here's this little tool you can now bill for, a new procedure in office. And I think, from an investment standpoint, we wouldn't invest in something like that. We're trying to pull costs out of the system, but there's there's a lot of solutions out there that say we're going to better manage your patients, we're going to make everybody healthier. And when everybody's healthier, less visits for doctors, less dollars out the door for consumers and patients, and savings for plans and insurers.
I think you almost always need to go in with a bit of a cost savings model and fairly quickly, because again, at 1% profit margins for providers and payers not well, you can't say, oh yeah, over 5 years we're going to save you X, and you need to have a fairly rapid return on investment against that capital. And the inexorable shift in this industry is CMS is reducing their reimbursements year over year. The Washington State Medicaid program just retroactively, I think it was in June, for going back to 2015, said, you know what, we're going to go back to last year and cut Medicaid rates 8%. So just in 1 year, they said, and I forget what Medicaid is, call it 40% of the dollars spent in the state, and they said, we're going to cut that 8%. And that was a retroactive decision the providers had to live with. So, and that's just going to happen year over year. So unless you're driving costs out of the system, you're going to have an incredibly hard time selling something in at an improved patient experience or this improved look and feel or design or something. But you need to have something that's going to ultimately drive to an ROI.
But the question is very apt, because we're clearly focused on helping reduce costs, and the question is, does that actually sell, right? And most observers are saying it may be a tough sell today, but it's going to be the sell tomorrow. And since canonically it takes you 7 to 10 years to get your idea into a product or service in healthcare, you better bet now that by the time you get to market, cost is going to be a really big deal.